Hi, I'm Katie Duke, and I've been a nurse for over 20 years. Listen, I used to think that I was my most stylish in my 20s, but honestly, style and confidence only get better with age. And that is why I love Figs. These scrubs are beautiful, comfortable, and they are built to last. They're not those boxy, scratchy uniforms that we all started out in. No. These fit perfectly. They feel amazing, and the quality is just wow! My favorite color? Burgundy. It's chic, it's timeless, and it's even the same color as my apartment, because I'm kind of obsessed with it. And I love adding custom embroidery to make my scrubs as personal as my style. And since I work in telehealth, my embroidered Figs even double as my ID badge. It's never too late to reinvent yourself or your scrubs. Get 15% off your first order at wearfigs.com with the code FIGSRX. That's wearfigs.com, code FIGSRX for 15% off your first order.
If you're a Gen Xer like me, you probably grew up on hose water, Mountain Dew, and the vague understanding that 8 glasses a day was the gold standard. Fast forward a few decades, and now we're juggling high blood pressure, cholesterol, joint stiffness, hormones, sleep disruption, and a medicine cabinet that looks like a small pharmacy. Hydration suddenly isn't just about quenching thirst. It's about heart health, metabolism, cognitive clarity, and yes, better sleep. On today's episode, let's unpack this in a way that makes sense for where we are in life. I'm Jay, and this is Somnilopod. Hello, everybody. Welcome back. I'm so glad that you're here to join me, and hopefully this topic will mean as much to you as it has to me. One of the things that I've been trying to focus on a little more is kind of expanding my awareness of things that have to do with my own personal wellness. And hydration is one of those things. As I mentioned in the opener, I grew up just drinking whatever was available, and usually we were outside, so yeah, the hose was handy. Inside, I was a kid, so sure, I wanted a nice sugary drink full of caffeine. But as we get older, for example, by the time we reach our 40s and 50, our body composition changes. Lean muscle declines, and with it, total body water decreases. Muscle holds more water than fat tissue. So as muscle drops, our hydration reserves shrink. This means that dehydration can sneak up on us faster than it did when we were 25. And add to that a reduced thirst sensitivity as we age, increased medication use, which for some of us alters the fluid balance, higher rates of high blood pressure and diabetes, and increased caffeine and alcohol use for energy and stress. Hydration is no longer passive. It's something we need to be a little more intentional about. So what does water really do for us? Well, it affects our blood volume and circulation, our kidney function. It also helps with temperature regulation, brain function and alertness, as well as joint lubrication, digestion, and bowel regularity. Even mild dehydration, as little as 1 to 2% body weight loss, can impair concentration, increase fatigue, elevate cortisol levels, and cortisol, as you know, is not our sleep's best friend. There are some pitfalls that Gen Xers run into. 5 that I'm going to talk about here today. The first is mistaking caffeine for hydration. Coffee and tea contribute to fluid intake, yes, but high caffeine intake can increase urine output and stimulate the nervous system. So many Gen Xers run on coffee during the day and wine, or in my case, bourbon, at night, and that's not hydration. That really causes oscillation, making fluid levels rise and fall artificially. Second pitfall, over-relying on sports drinks and energy drinks. Now, most people doing desk work don't really need electrolyte beverages loaded with sugar. Unless they're sweating heavily over an hour, Plain water is usually sufficient. Excess sugar can worsen insulin resistance, something that our generation is already battling. And don't ignore medications. Many Gen Xers are now on antihypertensives and beta blockers and diuretics, and these directly affect fluid balance. Also, drinking too much, too late. And this one hits sleep hard. You hydrate responsibly all day, then chug water at 9:30 p.m. because you realize you forgot, and that whole 8 glasses a day kicks in. And then that nocturia at 2 a.m. isn't really insomnia. It's really just about timing. Finally, the alcohol factor. Alcohol suppresses vasopressin, so that nightcap contributes both to dehydration and sleep fragmentation. So as I mentioned earlier, how do diuretics really fit into the picture? And this was really my main concern because I take several because I have heart issues. So it helps to take care of that and keep fluid off my lungs and all that good stuff. But many people in our age group are on them. So diuretics like hydrochlorothiazide, furosemide, triamterene combinations they're prescribed to reduce fluid overload and to lower blood pressure. They increase urinary output by altering the kidney sodium and water reabsorption. So here's what that means practically. You will urinate more. You will lose sodium and sometimes potassium. You can become dehydrated if your intake doesn't match your output. And the timing of this really matters tremendously. It's a balancing act. So if you're, like for example, if you're on a diuretic, you really need to take it in the morning whenever possible, and spread that hydration early in the day. You need to monitor for lightheadedness, dizziness, dry mouth, rapid heart rate, and muscle cramps. Discuss, and if you're on a diuretic, your physician has prescribed it. So be sure and discuss your potassium monitoring with him or her. That is one problem that a lot of people on diuretics can run into. Now, overhydrating while on a diuretic can also be problematic. Drinking excessive water can dilute the sodium levels in your blood, which in severe cases can cause confusion, headaches, and even seizures. So the goal is steady, consistent intake, not extremes. And it's really a double-edged sword where sleep and hydration are concerned. If you drink too little fluid, you'll have a chance of increased nighttime leg cramps, elevated heart rate, dry mouth, and nasal passages, which for people on CPAP can worsen their tolerance. And if you're not on CPAP, it can worsen your snoring. Increased cortisol, our old friend, or rather our old enemy, and headaches. But too much fluid can cause nocturia, or nighttime urination. It can fragment your sleep, it can reduce your REM sleep continuity, and it can increase fall risks in older results. Getting up and down out of bed at night, you're not quite alert, and you'll trip over something. So those fall risks are increased as a result. Now, there really is a sweet spot. For most adults, you want to aim for a pale yellow urine during midday. Try to front load your hydration before 6 p.m. and then reduce your fluid intake by 2 to 3 hours before bedtime. Limit it to some teas that may help you sleep. Don't drink anything with caffeine. Don't drink any alcohol. And if you wake up thirsty overnight, take small sips. Don't just chug down a full glass of water. Hydration supports melatonin production indirectly by stabilizing your metabolic stress. So dehydration raises cortisol, and elevated evening cortisol suppresses that melatonin. So there's a subtle but real connection there. Hydration for Gen Xers isn't really about carrying a gallon jug around or posting about it on social media. It's about metabolic stability, cardiovascular health, cognitive clarity, and yes, consolidated sleep. Water is a foundational medicine, quote unquote. It's not flashy, and it's not something that usually trends, but it works. And as most things in life, especially midlife, the magic is in the consistency. I hope this has been helpful for you. I know I've got a lot of good tips. I'll have some more information on some things to do as far as your drinking strategies during the day in the Patreon group. So check that out. You can also check things out on YouTube and Facebook. And until we talk again, please remember to make sleep a priority. And that causes your kidneys to excrete more water.